Hello, my name is Aarya Ramprasad and I will be presenting on behalf of my team's poster named Communal versus Agentic Spoken Language Among Surgeons in the Operating Room. So research on linguistic patterns in the workplace is often categorized as agentic or communal, with communal language being the language of we, with traits of kindness, warmth, support, and being a team player, while agentic language is considered the language of I, including ideas of leadership, independence, and getting the job done. There are many research associations between communal language and the female gender and agentic language with the male gender. Education and participation in surgery is often influenced by many things, including power, gender dynamics, stereotypes, societal constructs of gender, and others, which can also impact learning environments and patient outcomes. So we wanted to see if knowing more about the workplace language in the OR could allow for a better understanding of the crisis that we can see in surgical education with inadequate operative experience. Our aim was to examine how gender and PGY level/experience are reflected in language utilization by attending and resident surgeons in the operating room. Our methodology included a retrospective review of de-identified OR transcripts between attendings and residents. These transcripts were edited by a list of criteria created by our team to provide more accurate results on the software named LIWC, or Linguistic Inquiry and Word Count Program. The transcripts are run through this program as computerized text to help understand thoughts, feelings, personality, and motivation of language. Statistical analysis will be future completed using the numerical results of the LIWC correlated with gender, teaching experience in years, and the PGY level. We also have a manual coding of a subset of transcripts that will be completed using analytical framework that we have modified based on the Gender Communicative Accountability Structure from Grabowski-Lippmann's 2017 paper. So for our results, we have results from one transcript here split by the resident who is male and attending who is female. There are many LIWC categories and a few are listed here, including analytic, clout, authentic, tone, I, we, anxiety, anger, sad, social, and others. I've chosen a few results here to discuss with you. So, in the resident column, we can see that there's a set of numbers, and in the attending column, we can see there's a set of numbers. So these numbers we'll discuss a little bit more in the discussion area. On top of that, we have a few manually coded examples. For our agentic example, the resident states, I do not want to make it bleed, and the attending says, okay, I'll take a wet laner. The communal examples, the resident states, do you think we could some kind of retractor on the thyroid and see if we can retract it that way? And the attending says, oh, do you want me to grab it better or are you good? So we'll go into analyzing these tables and these examples a little bit now. So for LIWC in this table, each number is a percentage of the total words in that category. For example, a higher number in clout is a person speaking from experience and with confidence. A higher number in authenticity refers to a more honest, personal, and disclosing voice. Clout can be considered to be agentic, while authenticity is considered to be communal. Other agentic categories in this table include certainty and power, while communal categories include tentativeness, social, and non-fluency. So, for a further analysis, this attending, who is a female, she holds higher clout and authenticity. This is kind of contradictory because it is both communal and agentic. She does score higher in other categories that are, quote, typical for women, including high tentativeness, low certainty, higher social discussion, and less power. Non-fluencies indicate indecisiveness. This was numerically similar for both surgeons. The resident, who is male, ends up having lower clout, and this is possibly due to having a lower level expertise compared to the attending. So for our manually coded examples, the resident's agentic phrase is an example of rationality, where one will speak with information based on reason or with logic. The attending's agentic phrase is an example of assertive/direct speech, which is a clear and congruent style of speaking. For the resident's communal example, this is an example of hesitant speech, which is a pattern that shows uncertainty via roundabout phrasing, and you can see many of the us in the sentence can indicate that uncertainty. For the attending's communal phrase is an example of asking questions, and this can help mitigate threatening speech by bringing attention to something else in the form of a question/interrogative to make it less direct. And so kind of using these examples, we plan to continue to do further analysis, and using these numbers and definitions hopefully create a group analysis to see if there is a statistical difference between power status and genders in the operating room. Thank you so much for your attention, and I would love to take your questions.